Hi, I'm Dr. Charlie Schuster with Back to Health. We're putting together a little module today on foot function and how important feet are to our spine and our knees and our hips and everything. There's a important concept that we need to discuss when patients come into the clinic. Maybe some of you have read the book Barefoot Running or heard of it. I can tell you from firsthand experience, a lot of people made it into podiatrist's office, foot specialists, chiropractors, physical therapists, because they decided to start running. I want to say one thing about the feet. They are made to move, no doubt, but they're not necessarily made for man-made surfaces, concrete, wood, tile, and most of us inherit some flexibility in our ligaments that's really too much for how the foot functions. So the majority of patients we find that come in with back pain or hip pain or knee pain or arthritis, wear and tear type in the knee, hip, chronic ankle sprains, goes on and on. We have to start with the feet. And so if you came into our clinic and you had a shoulder problem, we'll work with your shoulder. We want you to feel good. We want your shoulder function to be important. But if you say, I want to be able to be active when I'm 75 and have good mobility and have good energy, the thing that I would say that's going to stop you is if you move wrong throughout your life, it's going to catch up with you. I always use the analogy of a snowball that starts at the top of the hill and it gains momentum as it goes downhill. And that's what we do in our 30s and 40s and especially 50s and 60s if we don't start practicing proper movement. So on these videos, we talk about mobility. You won't see me showing very many stability type exercises. Personal trainers are wonderful, and I highly encourage people, our patients particularly, it's a goal of ours that you could be ready to have a personal trainer, someone to help you get started with stability. But our job is to make sure your neurology is right, to help you get the blueprint right first, to make sure your software doesn't have viruses, to make sure that you have a proper foundation for movement. So having said that, I'm going to do a little segment here on orthotics and the importance of them. When a person comes into our clinic and they have a fallen arch, pretty common name for it, that arch, and I'm going to put my foot up, pretend I'm standing for the sake of being able to see this. I think we can catch this on the GoPro here, but if you look at my arch when I'm standing, it looks pretty significant if you zero in there, doesn't it? I would say that's a normal arch if I saw it. But if you watch me step down, there you go. You see the instability in my ankle? If you look at it from this angle right here, you might see that I roll in. And I'm not trying to do that. If I actually try not to, I feel like I'm balancing. But for me to not feel like I'm balancing, my foot rocks in. And we know that if that foot drops like over 9 millimeters, that's a severe amount of foot drop. And so I would say I had severe pronation. I'm a little picky, but you know, I actually try to prevent knee and hip problems and back problems, not just treat them. And so incidentally, about age 12, we ought to be checking for this navicular drop or how much drop that arch has. Because at that age, we can catch before most injuries occur any problems with biomechanics that are because of the feet. And so if that foot rocks in, if you look at my knee should track up and down like this. But when I step down and my knee is pointed this way and I actually put weight on that foot, if you look really closely, you'll see that knee is now pointing in this direction when it was this way. Not only does my knee rock in, but my hip tends to rotate outward, can create a condition of the hip, improper motion in the hip. And it pulls my pelvis forward, same side. You say, well, what if you do it on both sides? And most people do to some degree. It just gives you this. Too much curvature in your low back. It creates a false belly and creates all kinds of issues at the lower part of the lumbar spine. So a good orthotic supports your foot in all positions, because a lot of times we know about 20% of orthotics really do work for people. But that's a pretty high failure rate, 80%. when people go to a generic. And so a generic orthotic, from studies that we have, approximately 20% success rate. So if you're in that 20%, awesome. But most people need one that fits their arch, just like you can't necessarily go down to Walmart and get a pair of glasses that are going to work for you. You may need to see the optometrist, you know. So when an arch is supported correctly, and I have folks that come in and they've gotten their, you know, infomercial orthotics, I like to see two things. One, I like to see if it matches their arch when your arch is in its optimal position, and when that's during toe off when you're running or walking. And so if you can do that, you'll see your arch is in its best position. I like to see if that matches up to their orthotic. In a prescription orthotic, that's a perfect match. However, that's not enough. So we got to have your arch in its best position. That's really important. I use sole supports out of Nashville. They're phenomenal. We've had very good success with them because they match that optimal arch, and they have the flexibility geared within a degree to that person's flexibility. And each of us have a different foot flexibility. So when we hold your heel and we rotate your foot, some people we can rotate their foot all the way, some we can't rotate at all, and there's degrees within. So getting that flexibility down with the proper fit is such a trick. And they're experts at sole supports with that. That's the orthotic we recommend because we don't have time to try things. We want our patients to have the best one life that we believe they're going to have. So that's important for us to get that corrected because as you look, when I step down now in an orthotic, literally all the energy leaving my body into the earth is coming back to me because my arch is coming back on its own as it should. And it shouldn't require any extra muscle work from my shin, so I shouldn't get shin splints. And I don't. My knee stays stable all the way through gait. I don't recruit my hamstrings and my glutes to try to support, you know, my low back muscles to try to support my pelvis, just because I'm being supported correctly with a good orthotic. So I just wanted to make sure that we emphasize that importance because step one in a rehabilitative process for anyone with abnormal function or structure in their spine that has abnormal stress lines, step one is orthotics. I recommend them for virtually 100% of our patients because even if there isn't a pathological problem with the foot, we want to prevent it. I still advocate going barefoot, but on sand, grassy loam, and for short periods of time, as opposed to all the time, because it's important to be able to continue to use all of our muscles in our foot, and shoes really keep us from doing that. But I will also say that when somebody's in an orthotic standing, they ought to be more stable. And so I'll test a person from behind to see if they're wobbly, and when they are on their own feet and then they aren't on the orthotic, I know that's helpful. And so some generics will actually do that, and they'll actually stabilize the nervous system, and I'll know that because I'll check a hand muscle and it'll be strong, or a voluntary muscle like the bicep, and it would be weak if they're unstable. Strength coaches always say you lose neutral position, you go weak. You know, when somebody does this during a squat, they're going to go weak. They want that neutral position. Well, your spine can't be in its most neutral position with your feet rocked in, your pelvis rocked forward because your hip is out, and the balance is just not there as well. So that's what we check. A good pair of orthotics will last years, if not decades. Things that will affect them are weight change. They can be calibrated if you lose weight. You can't add material. So oftentimes when somebody gains 15 or more pounds and they start not having the support they need and the symptoms start returning in their iliotibial band, their hip, their low back, their feet, it's time to change their prescription. However, they can be recovered as well. And so, you know, when you start to think about the cost of a good pair of orthotics, you know, they can be anywhere from, you know, $10 for generic to maybe $1,000 for the best prescription orthotics. It depends on what level of specialist is prescribing the same orthotic. You'll find that to be the case. Sorry about that, specialist, but I don't care what you're paying for them. They're so worth it. And their preventive measure that they provide will bring dividends better than any investment you could possibly make, and are worth setting up even a small payment plan on, to be sure that at least step 1 is completed before step 2, 3, or 4, and that you're getting that good stability and fit in the first step to any good spinal rehab, hip rehab, knee rehab program is making sure that your foot biomechanics are correct. Can't emphasize that enough. Thank you.